Hello, my name is Mary Edmonds and I am a senior lecturer in the acute care department at Anglo-Ruskin University, Cambridge. I'm going to explain to you today how to do a 12-lead ECG and why that needs to be done for some patients. First of all, before we start with the procedure, we need to think about what is a 12-lead ECG and what is it recording. It is recording the electrical activity of the heart and of the myocardial cells, so that if anything is changing that conduction, then that is going to be reflected on the 12-lead ECG. If you imagine it, it's like watching a football match sitting from 12 different positions, and in the one snapshot you get a view of that match. We need to think about why we're going to be recording a 12-lead ECG, why our patient would need that. There are various reasons. There is doing one for a routine preoperative procedure. There is assessing our patient's clinical status. If they should worsen in any way, then we can look at how well the heart is performing electrically. What we must remember, though, is that we're not looking at how it's working mechanically. So from a 12-lead ECG, we cannot tell how effective their blood pressure is or how effective their cardiac output is. Before we start the 12-lead ECG, we need to think about the patient. We need to prepare them for that procedure. Ask them if they've had the procedure done before, explain to them what is going to happen. It's important to say it's not going to hurt. It is one of the few things we do that doesn't hurt patients, but patients often worry about it when we bring machines to them and we attach them to lots of wires. So we need to ask the patient, have they had the procedure before and do they know what's going to happen? If they don't, then we need to explain to them what we're doing. If you're doing it just because it's a routine ECG, then it's important to tell the patient that actually it's just doing as part of the tests they need to have an operation. If the patient has said to you they've got chest pain, then we need to explain to them why we're doing that 12-lead ECG, because they've got chest pain and we need to find out what's happening to the heart in terms of the electrical system and looking for certain abnormalities, which then can be used to help them in their management. So first of all, after explaining to the patient, after getting their consent, we need to think about what equipment we need. This is a 12-lead ECG machine. You need to make sure that the ECG machine is that you've got your leads all correctly connected. On the end of the leads, you will have different attachments that can be pulled off and put onto the end. What's important about these connectors is that you need to make sure that they are compatible with the electrodes that you are using. As well as the equipment we need, we also need to think about how we're going to prepare the patient's skin. We need to have a razor if a patient has a hairy chest, because we're going to need to remove those hairs on that chest region. We're also going to need to think about how to remove the oils from the skin. For that, we will use an alcohol swab on the skin, and then we will use a gauze swab to wipe it dry. That's particularly important if someone has chest pain and they are cold and clammy. We need to make sure that when we apply the electrodes that we've got a good contact, because otherwise it's going to affect the reading that we get when we use our 12-lead ECG. We are now going to put the electrodes on the patient's chest. It is important to again explain to the patient what you're going to do so that they understand what is happening. You need to think that before we get to the patient's chest, we need to make sure that the screens are around to be maintaining dignity at all times. As you expose the chest, you need to make sure that you're using the bedclothes to keep the patient's chest covered. So even when you're bringing their bedclothes up, that you're keeping the chest covered. We know that we need to prepare the skin. So this person doesn't have any hairs, so we need to still wipe the skin. So we need to open the swab, explain to the patient what you're doing, make sure that they're not allergic to the alcohol swab, and then make sure that we're drying it well with a gauze swab. It's important to do this because we want to make sure that we get a good skin contact with the electrodes so that we get a good reading. Once that's been done, we then need to think about applying the electrodes. Now, to do that, we need to use some of the landmarks on the patient's chest. So we need to feel for the clavicle bone, and that's that prominent bony part at the top of the rib cage underneath the chin. We then need to be putting the electrodes in certain positions because we want to make sure that they're going to give us correct readings of the activity in the heart. Feel that clavicle bone, and then we need to go 4 intercostal spaces down to the right of the sternum. So that's there. 1, 2, 3, 4. You've got your electrode there, and you need to place that electrode slightly to the right of the sternum bone. You don't want to put the electrode on the bone because it's going to affect the conduction. We then need to apply a second electrode on the left side of the sternum. So again, it's important to be checking. Feel that clavicle bone. 1, 2, 3, 4. I'm putting it there. This electrode is known as V1. This electrode is known as V2. We then need to think about placing the other electrodes. Rather than trying to find the position for V3, it's much easier to place V4. V4 is going to be placed at 5th intercostal space, mid-clavicular. So you need to be looking to see the middle point of the shoulder and coming down, and that is going to be in the 5th intercostal space. So you will see that you've got a line there, and then you've got a second line coming across the chest there. Once you have V4 in place, you can then put V3 in place. Next, so I'm going to put in V3, which goes in between V2 and V4, in line with the V4. Then I'm going to put in V6, which is going to go mid-axillar, also keeping it in line with the 5th intercostal space. V5 goes in between V4 and V6, 5th intercostal space. So we've got a line of V1 and V2 in the 4th intercostal space, and V3, V4, V5 and V6 in a line in 5th intercostal space. It's important that we've got those 2 straight lines. We do not want to see a horseshoe effect on the chest, because that will mean that the electrodes will not be in the correct place and we could misdiagnose whatever's going on with the patient. What we need to do next is put on the limb electrodes. So we need to cover the patient's chest up, so again maintaining dignity, and then we need to apply the electrodes onto the limb. So we need to get the person's arm, and the electrodes need to be applied on the underside of the wrist. Why is that important? Well, it's important because you've got less hairs there. If you put it on the top, then actually, again, those electrodes are going to perhaps have poor contact, and that's going to affect the reading that we take. So we apply one to the underside, okay. Then we take the patient's other arm, and put that there. Obviously, we need to be careful here because the patient's got a drip in their hands, so we need to be making sure that there is good contact. We need to get to their ankles and their feet. We need to put the electrodes on the feet. Again, it's important to be avoiding hairy areas. So you can either put them on the ankles, you can put them on the feet, on the top side, but the only trouble is that sometimes patients will move their feet, and when it comes to the recording, that can cause interference. So again, we need to be putting another electrode on the top side of the leg there. So now we have 10 electrodes in place, but we're going to be recording a 12 lead ECG. So it's important to remind you that we are going to be putting on 10 leads, but we get 12 views, and it's views we're getting of the heart. from different positions. So what we need to think about now is putting on the leads. So I need to put the attachments onto the end of the electrodes. So that's C1, C2, it's important to make sure that they all stay stuck on, so if they should move, or if the person is very sweaty and clammy, that they all remain in contact with the person's skin. Once we have attached all the leads, we need to make sure that they are all on in the correct order, so that they all follow through from C1 to C6. We need to make sure that obviously the limb leads are on the right way, so we've got the R on the right arm, we've got the L on the left arm, we've got the F for the left foot, and we've got the N for the earth on the right foot, and they're all correct. We then need to ask the patient to relax, to be in a comfortable position, because if they should tense up, then we will pick that electrical activity up on the 12-lead ECG machine. So we need to say, just stay nice and relaxed, to breathe normally, not to hold their breath, because again, that will make them tense up, and then to press the machine. Once we've taken that recording, we then say again, obviously, to lie nice and still, and we take the electrodes off. If it's just a one-off ECG, then you can also take off all the electrodes as well. If you are working in an area where you are going to be doing continuous ECGs, then you need to make sure that you're using the correct electrodes to allow that continuous use. Again, make sure the patient's chest is covered up. Also remove the limb electrodes and the electrodes as well. Oops. Remove the leads on the bed. Cover up the patient. Make sure they are comfortable. If you're doing the 12-lead ECG because they've got chest pain, then you need to be asking them how their chest pain is, giving it a score or getting description in words, and then writing that down with the information that you're recording on the 12-lead ECG, and then showing that 12-lead ECG to somebody who can interpret it, so that you can get a diagnosis straight away for that patient. If your patient is wearing any metal, such as a watch, a bra or jewellery, these can remain in position. You just need to be careful that you're not placing the electrode very close to that article. In fact, wearing a bra can be quite helpful and extremely useful, because it means that you can place the electrodes underneath the breast tissue and keep them in the right place. Do not put the electrodes on top of the breast, as this will mean that those electrodes will not be in the correct place and you will get an inaccurate reading. Dignity must be maintained at all times.